Hi, my name's Ava, and this is my presentation on deaf disparities in healthcare. And the issue focuses on how deaf and hard of hearing individuals often receive unequal healthcare compared to hearing patients, and what public health workers and communities can do to fix that. Okay, so first, what is the issue? Healthcare is supposed to be equal and accessible for everyone, but many deaf adults report being denied access to services simply because no interpreter is available. The main problem isn't hearing loss itself, it's the communication barrier between deaf patients and hearing doctors. My goal today is to highlight why this inequality exists and what changes can be done to help provide equal care. Why it matters. When someone can't communicate with their doctor, they might receive the wrong medicine, misunderstand treatment instructions, or avoid seeking care altogether. That creates worse health outcomes, not only for the individual, but also for the entire community. Public health professionals have a responsibility to help make sure healthcare systems treat deaf patients fairly and respectfully. And communication barriers. The lack of trained interpreters is one of the biggest causes of health disparities. Not every medical provider knows sign language, and written English materials often don't match the communication needs of deaf patients. Some telehealth tools also don't include captions. These barriers create mistrust and can make deaf patients feel left out of their own care decisions. Some key statistics are that the World Health Organization reports that about half of all hearing loss cases are preventable, especially in places where diseases like meningitis or rubella are still common. Even in the United States, many deaf adults say that they've been denied proper care due to interpreter shortages. And in rural areas, the problem's even worse. People may have to travel very far to find a hospital with interpreter services. And a statistic for this is that 32% report being denied interpreters in medical facilities, and over 80% of people experiencing unmet communication needs in appointments have had health complications because of this. And this is only going up because the prevalence of hearing loss is going up. So, individual interventions. There are many ways that deaf people can protect their own health. They can learn their legal rights under accessibility laws like the ADA. Many people don't know that they have the right to request interpreters, captioning, or visual communication tools, and staying connected with deaf support networks also helps the spread of knowledge and give people the confidence to speak up for their needs. And community-based support is community programs that play a huge role in closing the healthcare gap. One example is the Maryland Governor's Office of the Deaf and Hard of Hearing. This group helps deaf residents access hospitals and trains healthcare staff on deaf culture. They also give important feedback to state leaders to improve policies that affect deaf healthcare access. And national level of support is that the National Association of the Deaf works across the entire country to enforce laws like the ADA. They help patients understand their rights and push for stronger interpreter requirements in hospitals. Advocacy is important because no matter how good a law is, it doesn't matter if hospitals don't follow it. And healthcare system interventions. There are hospitals leading positive change. The University of Rochester Medical Center has a deaf health program that provides workshops and health screenings fully in sign language, and they bring healthcare workers, interpreters, and deaf residents together in the same space. And this just shows that when accessibility is built into the system from the start, that everyone can benefit. And how we can improve care is to solve this problem long-term. Accessibility needs to become the standard, not something that hospitals scramble to provide last minute. Increasing interpreter staffing and deaf awareness training are major first steps. Healthcare systems can also include deaf leaders in decision making, so policies reflect the real needs of a community. So, in conclusion, deaf disparities in healthcare aren't caused by hearing loss, they're caused by communication barriers. When we remove those barriers, healthcare outcomes increase dramatically, and change can happen on every level, from individuals knowing their rights, community advocacy, and systems that prioritize accessibility. Everyone deserves to have clear and fair medical care, and making accessibility normal moves us closer to a truly equal healthcare system. And here are my sources. Thank you.